Hello, my name's Philip Coleridge Smith. I'm the president of the British Association of Sclerotherapists. A number of our members have asked us about what to do concerning the thrombotic risk posed by COVID-19 infection. So I've prepared this presentation in order to help answer some of the questions which have arisen. COVID-19 produces a severe pneumonia and includes the possibility of severe respiratory failure, multi-system organ failure, and thrombotic events. These may lead to death, and already in this pandemic, 130,000 people have died in the UK, and 4.25 million people have died around the world. This condition may also give rise to long COVID, with persistent symptoms over many months. Vaccination now offers a safe and effective method of preventing the condition, or at least the most serious effects of it. Serious adverse events arising from vaccination are very uncommon, but include anaphylaxis, thrombotic events, and Guillain-Barré syndrome, as well as more minor side effects. The question is, what should be done in order to protect our patients against venous thrombosis arising from COVID infection? My friends and colleagues at the Venous Forum of the Royal Society of Medicine have considered this and prepared a small advice document. These are the factors which might be considered, according to the Venous Forum, risk factors for venous thrombosis. In fact, all except the first one are taken from NICE Guideline 89, which lists things like previous venous thrombosis, known thrombophilia, reduced ambulation, obesity, estrogen therapy, etc., as major risk factors giving rise to the need for thromboprophylaxis after many surgical procedures. The Venous Forum have added COVID-19 infection, which is clearly a risk factor for thrombotic events. And they think any infection which has occurred prior to 3 months gives rise to a risk, and a very high risk if it has occurred within 3 months. They've drawn up some recommendations as far as prophylaxis is concerned. Pathway 1 is the standard pathway in which patients at low risk need no thromboprophylaxis, but those with one risk factor need either low molecular weight heparin or rivaroxaban or apixaban, and possibly people with high risk with 2 or more factors need an extended period of prophylaxis. However, in the days of COVID, almost everybody needs some form of prophylaxis after surgery, and with higher doses of low molecular weight heparin or increased duration of prophylaxis for people with one risk factor, and up to 6 weeks prophylaxis for people with 2 risk factors. This rather complicated diagram shows what should be done for patients at low risk, those at intermediate risk, high risk, and those who've had recent, that is within 3 months, infection with COVID. Well, this is a rather complex system. The question is, what should I do in order to protect my patients against venous thrombosis? So I would discuss the thrombosis risk with all patients if that seems appropriate. I would probably not discuss it in any detail with people undergoing sclerotherapy for telangiectasias, because I think they are at extremely low risk of having a thrombotic event after sclerotherapy. I would avoid sclerotherapy within 1 week of any planned vaccination or any vaccination which have been done, because of course many people have some symptoms after their vaccination, and I wouldn't want my sclerotherapy to be blamed for the adverse events arising from vaccination. For people who are undergoing sclerotherapy for telangiectasias, I propose that no prophylaxis was given. However, for people undergoing foam sclerotherapy, where 1 or more risk factors was present, I would recommend rivaroxaban 10 milligrams daily for a period of 2 weeks. And I wouldn't extend that period beyond 2 weeks unless I was going on to do further foam sclerotherapy in the other leg. And the important risk factors that I would consider would certainly include recent COVID infection within the previous 3 months, and then any risk factor arising from the National NICE Guideline 89 list of risk factors. I hope that advice helps in conducting your own practice.